Hello, my name is Betty Bates. I'm a RNBSN student here at the University of Kentucky. I work for UK Healthcare at Telemetry Acute Care Unit. First, I'm going to summarize an article that I found online. It was published in June 2017, and it was published by Northern Kentucky Tribune. This article talked about how a nationwide opioid epidemic has affected people here in Kentucky. Every community in Kentucky has been affected in one way or another by drug abuse problems. The major drugs of choices that were mentioned in the article were fentanyl, heroin, and prescription pills. According to Kentucky Office of Drug Control Policy, there was over 1,400 deaths that was associated with opioids, which was 7.4% increase from 2015. Fentanyl, when blended with heroin, can be very lethal. The blended form was responsible for about 623 deaths that were reported last year. That was in 2016, which was up from 450 that was reported in 2015. The over 400 deaths that were reported in 2016 were patients who were between the ages of 35 and 44. In my unit, we get a lot of patients with drug addiction, and most of them have pain issues at the same time. A lot of them have tried rehab, but they still end up relapsing due to many reasons. Taking care of these patients is pretty tough because they have already developed tolerance to a lot of pain medication that we offer at the hospital. In many cases, we've had patients leaving the hospital against medical advice because we are not providing them with the pain medication they are asking for all the time. There are many ways of managing pain other than using opioids. One of the ways of managing pain is using OMT, which is a therapy that is provided by doctors of osteopathic medicine. Before I go on to talk about OMT, I'll first give you a preview of Doctors of Osteopathic Medicine. Doctors of Osteopathic Medicine was founded by Andrew Steele in 1874. DOs go through 4 years of undergrad and then 4 years of medical school and then residency, just like MDs. They also take board exams to get a license to practice, just like MDs. The main difference between MDs and DOs is that DOs are trained, they have license to do OMT, which is osteopathic manipulative treatment, which is the use of hands to diagnose and treat most of the diseases, mostly musculoskeletal issues. Currently, 64% of primary care physicians are DOs. There are a lot of benefits associated with using OMT. For example, it helps to treat structural and tissue abnormalities. It also relieves joint restriction and misalignment. It also restores muscles and tissue balance. And lastly, it promotes the movement of bodily fluids. There was a research that was done in 2005 They were researching about using OMT as a way of managing back pain, and it was pretty successful. Even though there are benefits of using OMT, there are side effects. One of the side effects is that most of the people who uses OMT have like soreness 2 days to 3 days after the therapy, and most of the people they need more than one treatment to help them. Uh, there are also people who are not allowed to use OMT as a way of managing their pain. For example, people who have bone cancer, bone or joint infection, osteoporosis, and spinal fusion. The next thing I'll be talking about is that like a lot of people don't know much about OMT. This is because most of them usually confuses OMT with acupuncture, or not acupuncture, chiropractors. What chiropractors do. So most of what DOs do is what chiropractors do, but in addition to that, they are practicing as physicians, just like MDs. So that's why most of the people get confused. The next thing I'm going to be talking about is about my teaching plan. My target audience for my teaching plan are patients who've been admitted in my inpatient telemetry unit who are 18 years or older and who have not tried OMT as a way of managing their pain. My main objective of my teaching is that the patient and the family, at the end of my presentation, the patient and the family will be able to acknowledge that osteopathic manipulative treatment is a possible new alternative treatment for their pain. So I also have objectives. Some of the cognitive objective is that the patient and the family will state 3 benefits of osteopathic manipulative treatment by discharge from the hospital. Another cognitive objective is that the patient and family will verbalize one side effect associated with osteopathic manipulative treatment by discharge from the hospital. Affective objectives includes the patient and family will agree to participate in the discussion about osteopathic manipulative treatment by the end of hospital stay day 2. Another affective objective is that family or patient will accept written information about about OMT treatment by discharge from the hospital. Also have psychomotor objectives. Some of these objectives include family or patient will Google some of the licensed doctors of osteopathic medicine practicing OMT around the patient's community within a week after discharge. Also, the patient or family will schedule an appointment with the provider practicing OMT before the next scheduled office appointment. Okay, so how am I going to evaluate my teaching? For cognitive objectives, learning would have occurred if the patient or family states the 3 benefits and 1 side effect associated with using OMT, which I had mentioned the benefits earlier and side effects. For affective, learning would have occurred if the patient or family accept written information and participate in the discussion about OMT. about psychomotor, learn with card if the patient or family uh, finds and contacts licensed provider practicing OMT and schedule an appointment with that provider. The next thing I'll be talking about is my teaching handout. Oh, you can't see that good. I'm going to upload it after this. My student handout. I'll be talking about OMT and what OMT can be used for, what kind of pain, what things to consider before you do the therapy, and lastly, and then I have what to keep in mind about osteopathic treatment. First, like according to research, there's a lot of pain that can there's a lot of pain issues that can benefit from using OMT. For example, for people who have low back pain, neck pain, sports injuries, repetitive injuries, and some kind of headaches like migraine headaches can benefit from OMT. So there are other things to consider before therapy. First, you have to ask the provider's training and experience. Make sure they are licensed. Check with the provider if OMT is for you, and never replace your medical care with OMT. Also, check to make sure your insurance will be able to reimburse after your therapy. So, what to keep in mind about OMT is that soreness usually occurs 2 to 3 days after manipulation. It's not for everyone, as I told you earlier that it's not good for people who have bone cancer and other stuff that I mentioned earlier. And another thing is that to keep in mind is that it may not treat your pain. It might work for some people and it might not work for some people. Also, it might take more than one treatment to manage your pain, and the rest are the resources, references. Thank you. Bye.